So 2023 is here, and we begin this year celebrating our 60th anniversary. So we really felt that this was the time to look forward to healthcare in the future, and look at that through the lens of young people. We can close down the presentation now for a second, I think, if that's good. And so on the in the room with me today is Aishah Farooq, who's going to be telling us all about herself, and her journey through becoming really engaged in the healthcare system. And I'm really hoping that we'll have some really good questions and chat. But to get started, we're here to listen to you, Aishah. Aishah, welcome, and thank you so much for joining us.
Thank you so much for the intro, Rachel. Hi, everyone. It's really lovely to be here today, and thank you so much for having me. So, by way of introduction, I'm a board member for the Children and Young People's Transformation Programme Board at NHS England. I'm a keen youth advocate, so I'm an alumni of the NHS England Youth Forum and a young governor for my local hospital trust, which is University Hospitals Bristol and Weston. I think youth voice is incredibly important, not just because I'm a young person, but because we are the future generation, and what we're shaping and influencing today will impact our tomorrow. So it's really important that we have a say today so we can shape what tomorrow looks like. And today we'll be chatting through how to effectively engage with young people and children, what some of the barriers and challenges might be, and how we can mitigate against that. And also my journey through youth advocacy and the things that motivated me and the things that really energized me to do what I do.
Brilliant. Aishah, thank you so much. So first of all, you mentioned your journey. Tell us about your journey.
So my journey started when I was around 16 to 17 years of age, because I had to access healthcare services. So I had to go kind of in and out of hospital and GP care. And when I was around 16, 17, it was an age when I wasn't really classified as an adult and I wasn't really classified as a child. I was a young person, but I was treated in adult areas very much like an adult person. And for me, that whole encounter, the whole interaction made transition incredibly important, because I had a really untraditional, unconventional transition journey where I felt like I should be treated differently. Didn't quite know how different, but I knew that I shouldn't be treated like an adult and I shouldn't have been treated like a child. So I thankfully got better, and as I started to realize through my local youth forum how I could quite shape and influence some of the trust decisions, I took part in things like the 15 Steps Challenge, which is a type of ward accreditation. When you go round, the idea being that the first 15 steps on the ward are give you a good indication of how you're going to be treated. So it gives you a really good kind of gauge on like the healthcare environment, the kind of friendliness, like the welcoming feeling that you'd get. And from there, I thought, I'm really enjoying what I'm doing. I'm really kind of enjoying the influence that I'm having. So I took it a step further and I joined as a young governor for University Hospitals Bristol and Weston. And that gave me a platform, and I'm a young governor, but that gave me a platform to really talk to decision makers within the trust and to shape decisions and strategy, which I don't think I would have ever known about. So I was involved in the Weston merger case, which was a business transaction that looked at merging two hospital sites together into one. And that's something that was unheard of for me. I had no idea that was something that was a possibility. And so going through the whole process, understanding, like as best as I could, understanding the whole kind of business transaction, and also the kind of like the pros and cons to it, and also the implication that it had on patients and the public was unreal. And I don't think it's an experience that everyone gets to have, not as a young person. And the influence that I had was also really important. So on a local level, I was able to see how I can influence things within my trust, within my area. But I joined the NICE guideline for babies, children and young people's experiences of healthcare. And that being on that committee was also a really unreal experience, because I was talking to clinicians, healthcare professionals, policy managers who were all so passionate about children and young people, and kept them at the focal point of all their discussions and their decisions. And there wasn't ever a meeting where children and young people were second. It was always, what would the child or young person think, or how does the child or young person want things to be done? Which I think is super important, because when you're making decisions about a child or young person, A, if it's about them, involve them, and B, make sure that they're kept right at the top, like at the top of the agenda. It's so, so important. So that was a really good experience.
Brilliant.
And yeah, the
So
youth.
actually, can I ask you though, because I think for us, the Patient Association, so we're non-disease, non-condition specific charity, and our strategy is very much about patient partnership in the design and delivery of services. And in our 60th year, and I've spoken to you before, I've met you at the NHS Assembly, and I know that one of the passions that you hold is around the inequalities of health. And to help, so from my perspective, and looking at the attendees on the call, I think a lot of people would want to understand, how do you get the voice in? Because there's somewhere in that conversation we're having with you, is you felt you had that power and to be able to get involved. How did your healthcare professionals help that happen, or did they, or was that just something that you felt you had and you could do?
Yeah, so I think personally for me, I was encouraged by my healthcare professionals, and I think, and it doesn't apply to everyone, but I think because I felt that something was a bit amiss in my healthcare journey, that I felt the need to kind of speak up about it. But I am so, so conscious that not every young person is going to be like myself. And sometimes engaging with young people who don't necessarily come out with their opinions or their comments or suggestions is slightly different to engage with them. And I think for me, we need to create those opportunities for those kind of young people to come up and for them to have a say on healthcare services, on things that matter to them. So, like personally for me, I think if you were trying to create those opportunities, it's really important to engage with local organisations. So in Bristol, we have Off the Record, we have Sorry, which is a race and inequality organisation. So it's really about tapping into those communities by going to places that they may potentially use or may potentially go to for advice. And that's how you can encourage and empower them as well.
Brilliant. Because I see it, my son, he's 22 and he's really interested in a lot of society issues, but he sometimes feels that when he's engaging with people my age, that it can feel very tokenistic, that they're asking the question, but sometimes he doesn't feel that they've really, so he's met some lovely people, he does, but how did you feel that your input was valued?
Really good question. So I think for me it was the recognition. I think it was also the acknowledgement, and also seeing my suggestions in a policy paper, or seeing kind of my comments that I had made on a Word document a couple months ago actually coming to life in a final briefing. For me, that really hit home, because it wasn't just listened to, but it was actually actively used in something that I was trying to influence. And I think recognizing contributions from young people and children is so, so important, because if you don't, it kind of looks like tokenism, because you've come to them with a plan, with an idea, and then it's kind of fizzled away because you asked a question, you've got your answer, and that's it. And also, sometimes by doing that, you're not showing meaningful engagement either. Having the whole rounded experience of showing the young person the potential project or the potential policy that you need advice on, and encouraging them on many different levels by using their experience, because don't forget that young people and children are experts by experience. So making them feel valued in whatever you're trying to involve them in is so important. And I'll show you later on, but there's a really helpful infographic that was created at the Youth Voice Summit in 2019 that shows the key factors that affect a child or young person's engagement, and what things you can do to make sure they have the best experience possible. Because sometimes meaningful engagement, when it goes wrong, when it fails, it doesn't just impact the here and now, but it actually prevents that young person or child from engaging in the future. And if they stop engaging in the future, that's potentially them not having their voice heard, you know, us missing out on a potential solution or change that we can make that would probably revolutionize the world. So
Yeah.
it's so important to get it right now.
Absolutely. And you've made a really key point there. And it's something that I was reflecting on today when I was thinking about how we were doing this webinar. And it is around, if a young person, and that, you know, a child or a young adult in healthcare, if at that point they feel that they have been disregarded in terms of their opinions and their views, we end up with a person who feel we're going to widen that inequality, aren't we?
Absolutely. Because not having your voice heard, and then also so what doesn't help is if you don't have your voice heard, and then if you're also from a community that isn't often heard as well as other communities, that puts you down even more. And I think the health inequality gap as it is quite large in quite a few areas. And actually a few months ago, NHS England have launched the health inequalities framework to tackle health inequalities, called Core 20+5 for children and young people, which I can actually show you. So if you wouldn't mind sharing the slide, please.
This is your Chris Witty moment.
This is indeed my Christmas. I usually share my own slides, so I don't get many of those moments.
Enjoy every moment of it. Brilliant. So tell us. So this is fantastic. So talk us through Core 20+5. I know people on the call will understand it, but you know, the most deprived 20% of the national population, because I did just have a question with you on that, because you talked about inequalities and communities.
Absolutely.
And for me, I wondered, was part of where you got that patient power to be able to talk, was that because of the role of school and the role of education and giving you that voice as well?
Absolutely. So I'll first kind of explain Core 20+5 for those who might not have seen it, because there was an adult version launched a year and a half ago maybe, and so it's a really nice journey, because actually children and young people from the NHS England Youth Forum, we did 2 health inequalities projects which were a year apart. The first one was focusing on education, so medical student education and their understanding of conditions affecting ethnic minorities. And then the Health Inequalities project that I led last year was looking at the social determinants of healthcare. So looking at how young people were affected by things like their location, for example, their education level, money, for example. So looking at the things that kind of matter day to day and how that was affecting their health experience and health outcome. And so as a result, both the health inequalities projects showed the need and the want from young people to tackle those health inequalities. I mean, we already knew that COVID-19 has definitely widened that gap. And so I guess the projects that we did validated that further. And so together with the Children and Young People's Transformation Programme Board, we started the work on the Core 20+5, the CYP. And it's really lovely because youth board members have actually been involved from kind of the beginning of this right to the production today. So youth board members like myself and the 6 others have also had the chance to work on this infographic to design it so that it's young person friendly. We've co-designed all the metrics, so each clinical area has a certain metric that you should achieve, and young people have decided that together. And So just to explain, core 20, as you said, Rachel, it's the 20% of the most deprived in a population. And I think the key thing to know with core 20 plus 5, with the actual approach, is that it is tailored for each area itself. Because the one thing we know, and I think integrated care systems are amazing for it, is that every area is different. Bristol is different to, for example, Bradford or Leeds. And it's understanding your community, it's understanding your local area. And so Core 20 looks at the 20% of the most deprived in your area. And then understanding that that has to be the main focus. But then the plus also includes other communities. So, for example, you've got ethnic minorities, you've got carers, for example, you've also got Gypsy Roma traveller communities. So you've got those communities in the plus group that you know are naturally unheard and who don't essentially voice their opinions or thoughts as much as others would, for example. So you also incorporate that into your 20% of the most deprived. And then the 5 comes from the 5 clinical areas. So these are 5 areas, and it's not exhaustive because we know that there are definitely other conditions that are affected by health inequalities, but these are the areas that we've picked out to be the most affected, I guess. So we've got asthma, diabetes, epilepsy, oral health, and mental health. So it's still in its kind of like early stages, but I'm so keen to watch the progress of Core 20 plus 5 for CYP. We've already seen some amazing things happen with the adult version, so I'm really excited to see what happens with the children and young people's version too.
I think the thing with this, I love it, but it's there, you know, the conversation you had there where you mentioned the plus and in the Gypsy families and you know, but for me, it's how still that question I think will come up is how do we engage young people from those communities, make them feel valued? How do we give them the power? So when we run focus groups and we regularly try to engage young people, and our focus groups need to do an awful lot better at it, genuinely. So I'm here to learn from you. You know, we have a recruitment process, and I think one of the questions in the chat is, you know, how do we reward? So we will give a voucher for £80 to each participant in our focus groups. I'm not sure that the funnest voucher is for young people, but that's something I'm looking at. And I'm looking from the Patient Association point of view about how we can actually make payments that doesn't affect inland revenue regulations and everything else. But how do you think Core 20 plus 5 and the group, the work that you're doing, how are you reaching out to all of those different groups? Because the fear is that we end up with people, some patients who have that power to have that conversation. And if we're not listening to all, we'll end up creating even deeper inequalities in other areas.
No, absolutely. So at the moment, as youth board members, we're utilising every sort of connection and strength that we have to talk to other communities of young people, particularly who are from kind of seldom heard groups. So, for example, I'm looking at conversations with my local like mosques, for example, on kind of health inequalities. But I think there's a real role, and I know you mentioned it earlier, Rachel, about the education system and health and social care, because I personally believe that health and education are intrinsically linked. And I think schools have so much power to really influence, to really shape and encourage young people and children from a really young age, because in a sense, children and young people, and I know I did, they view teachers as a like mentor. You know, it's probably the first figure you see 5 days a week for a substantial amount of time. And I think having a really good experience in school is one thing, but also utilizing the power of schools and how they can really push and encourage and almost start building that young person up to be or not necessarily an advocate, but build them up so that they are competent individuals.
Yeah.
who can feel like they can say, you know, anything in a safe space. They feel like they are being heard if they are, you know, like voicing their opinions on something. And I genuinely think like PSHE lessons are an amazing way of doing that. It's
Yeah.
been a while since I was at school, but and I know that PSHE lessons have probably moved a lot further since I was there, but I do know that I think having some of like prevention taught in PSHE, looking at kind of self-care, self-help is really vital, because I think it kind of comes down to communication and navigation. I think for young people, navigation within, you know, for example, if we're looking at NHS England's website, isn't the most easiest, because it is quite adult focused. So almost looking at alternative ways to tap into like networks that young people are already using. And I guess by default, children and young people are going to school and they are using school as a method of learning, and it's not just kind of like learning your English maths, it's also learning life skills, building that confidence.
Yeah.
And also if you can integrate things like preventative health measures like self-care, self-help, like mental health and well-being, for example.
And where else? So all of that, and because I completely agree with you. And but as a small organisation, I'm not sure how we're going to get into the schools with the amount of things I'd like to get into schools with. And PHSE still exists. It just didn't exist when I went to school. Um, but it is and we're going to come on to some questions now because they're coming in, which is fantastic. But what other ways can you communicate, do you think? Because I hear lots about TikTok. I hear lots about, you know, all these different social media ways that you can engage and hear what people are saying and try and engage them. But also the other thing, just from an inequalities point of view, is that we hear a lot about health literacy age of, you know, between 9 and 11,
Mm-hmm.
which probably is the same with a younger population.
Mm-hmm.
And you just mentioned NHS, and not wanting to pick on the NHS here, but across the board, and us including, we just had to do we did a lived experience advisory panel, and we had to do a jargon busting dictionary, because I realize sometimes that we speak in jargon as well, even though I think I speak, you know, very clear basic English. So how, and I think that's, you know, how would you talk to people? And I think there is a question that I saw in the chat box that talks about, in the finding time to introduce a separate communication stream for young people. You know, does it need to be a separate communication stream, or do we need to think about just how we communicate in general with public from health and care?
I think that's a really interesting and really pertinent point, actually, because communication is very, very key to everything. I mean, not just engagement, but also providing information. So the NICE guideline, for example, has a whole kind of recommendation section on communicating with the child or young person about their condition, about treatment options. And I think, I mean, that's very specific, but if we are looking at kind of general informational, even if you were to promote a youth forum or something, definitely using social media that that young people are using is really important. And I completely agree with you about not trying to widen the gap with inequalities, and that's why I'm a huge advocate for the digital side of things. But I also think it's important to note that there are other ways to engage with young people without having to go full digital. And I think sometimes it also comes down to the communities and the networks that you're tapping into, because you could be handing out a flyer, but if you're going to every youth forum and I'm not saying that this is by any means what you should do, that if you were just handing out like a poster or a flyer to every single youth forum within an area, you're already tapping into so many young people because they're seeing it. So it really is about going to where young people are and then fine-tuning it to how they want information delivered. But I'd always recommend, though, to help minimize the gap with inequalities, make sure that you are looking at your population in particular. So, for example, within Bristol, we are quite a diverse area, and that's why in hospitals and GP practices here, nearly kind of like every patient information leaflet is translated in a different language. and we have up to, I think, 7 or 8 languages available of one patient information leaflet. It's using, I don't want to say simple, but it's always looking at things like that and making sure that we can do it as wide as possible so that everyone's included, because you want equality in terms of how people are, you want equality in terms of how people are getting information, but then you've got to realize that you've got health equity that might be different for every population and every person.
Yeah, and we've got well, it says not a question, but it is, and it's somebody telling us that they use the ONS stats to identify areas facing disadvantage to create opportunities, and really positively talk about going to the place where the child, young person feels safe, rather than expecting the person to come to them.
Exactly.
And I think that's part of our issue around power as well. And I think that's whatever age you are, if you're walking into somebody else's environment, immediately that person is holding that power. So have you had experience, or have you heard a good practice of where people have done that kind of work, gone in? And when I did community engagement before, that's, you know, I treaded the ground. I went to mosques, I went to children's hospice care, I went to mosques, I went to football matches. I talked there about what did they want and what was the service they really needed. Have you had any good examples of going out and actually involving people in the communities they're in?
Yeah, absolutely. So from a more sort of regional point of view, I believe Yorkshire, I think West Yorkshire in particular, during the COVID-19 pandemic, had gone out to every single community centre you can think of. So everything from faith centres, so mosques to synagogues to churches, to also scouts and like youth clubs. And they, throughout the whole of the vaccination programme, engaged with faith leaders and also the public who are using the like churches and places of worship, for example, to understand what their hesitations were around the vaccination programme. And then they encouraged the faith leaders by giving them information in a easy, simple way for them to become advocates, you know, if they wanted to, but if to become advocates of the vaccination programme, so they could then instill that education to the public who are coming to visit them, because because the policy people who were doing this kind of exercise itself, they realized that there was a connection between the trust between faith leaders and the people coming to their places of worship. And for them, I think they went there because there was no way that people were going to approach them, I think. And you know, that's absolutely a valid point, that especially with children and young people, you need to come to them, you need to go to them, because anyone, I think anyone can kind of come to you, but it's always harder to reciprocate it sometimes.
Yeah.
And more locally, we ran a scoping exercise to create our priorities in our ICB area. And our ICB leads went out to any community they could possibly find and spoke to as many people as they possibly could. And they really utilised their local relationships. So, for example, I mentioned off the record, because every area would have or probably does have organisations which are unique to them.
So what's off your record, just for people? What do they do?
Oh yeah, sorry.
You know.
Off the record is a mental health advisory, almost like advisory charity organisation for young people. So I think it's young people aged 16 to 25.
Just for context of going out to them. Yeah, brilliant.
Yeah, exactly. So we approached them, who would have obviously a lot of young people that they could tap into. So I think, that's why I absolutely love integrated care systems, because it's a different approach. And I think integrated care systems really push you to go out to the public, to young people, to different communities, because you're serving the population, and the best way to understand the population is to go out, talk to them.
Yeah, yeah, and that's not your takeaway point because it's a good one, but we'll come to
Yeah,
that in a moment.
no,
So
exactly.
I want to go back to transition,
Mm,
Aisha, because we have a question on here, and it was, as a parent of a child with complex disability and learning disabilities who is approaching transition to adulthood, how do services intend to address the duality of child-centered approach with the right of the parent as carer and advocate? And I know from my previous experience working in children's hospice care, that transition into adult hospice care was a very, very difficult one for everyone involved with the young person. The young person, obviously, but the rights of the parents coming from a child centre that was very much wrapped around them to a service that felt very different. And you talked about your transition as well.
yeah, of course. So there's a lot of work that's been ongoing in terms of the Children and Young People's Transformation Programme and transition. So we've introduced the transition nurses, who are I believe they're the Burdett transition nurses, who work with organisations to improve their transition service, because we know that it is difficult to get it right, because not every young person is going to have the same journey. I had a very different journey, and I probably had a pathway that was very unique, and I don't think anyone, I mean, I haven't met anyone who's had something similar, so it was very easy to like fall into the cracks. But I think there is a lot of work that has been going on, and I'm a strong advocate for youth forums, because youth forums do a lot of work on transition. That's actually one of the primary ways that I got involved through improving transition services, was actually through my local youth forum. And I would really strongly like push for getting involved with youth forums to help improve
Yeah.
and see how you can improve transition.
And I suppose there's a couple of questions in the chat, and I think they're really, well, I think all the questions in the chat are important, but a couple about the role of young carers in Core 20, and of course parents who are also carers, and how to keep them involved in the young person's journey and involvement. Do you have any, are young carers involved in the Core 20+5?
They would definitely be part of the plus group 100%, because I would definitely say young carers are a community of, they're definitely a community that I would say go unheard, and it's, yeah, I think they do go unheard, and more needs to be done to improve the experience of young carers, because at the end of the day, they are ultimately young people, and they would have the same rights to be listened to, and to be taken seriously and heard. And so it is, I would 100% say that young carers would be included in the Core 20+5 framework, because they're pertinent to healthcare experience for that individual.
Brilliant. Aisha, you said you had another picture you wanted to show us.
I did, yes.
Didn't you? Yeah. And I think this might be the core point time to bring that in. So another Chris Wishy. So yeah, I hadn't seen this. I love this. I love the colours already.
Yeah. I think I mentioned earlier, we had a Youth Voice Summit in 2019, which was attended by the NHS England Youth Forum, our youth expert advisors at NHS England, and the youth board members, and young people from across the country. And at the Youth Voice Summit, just to give you all just a bit of context, we spoke about things which are a priority for children and young people. We looked at how we can start kind of aligning with the long-term plan, and we summarised everything in a document that I can send around afterwards.
Brilliant.
But this has always stuck with me, because this is the person infographic, essentially, that shows the best ways of engaging with a child or young person. So these are the factors that I was referring to earlier, which I think we need to nail to ensure that meaningful engagement happens, especially with young people. So I could go through like every point one by one, but just to pick up a few. Early engagement. I think to avoid that feeling of tokenism, to avoid the feeling of being used as just that last tick box to say that I've spoken to a young person in a young person policy. Getting them involved early on is really important, because by doing so you're giving the young person as much information as they need before starting, because systems are complex. It's not always the easiest thing to get your head around. So giving them the time to digest, absorb, and then to kind of like lay out how you want them to be involved, I'd say it's really key.
Can I just add in there to that one? Because what I find quite often when I'm speaking to systems around involving patients, and this is across the board, it's department, ICSs, NHS, local hospitals, is it feels like people feel that they have to have a thing to come and go, is this a good thing? Rather than coming to young people and to patients in general and saying, what service do we need here? So is that what you're saying there? They need to come and say, there is a service we think we need in this area. What does it look like?
Yeah, so both actually. So I think I think for young people, going in with what's your priority and how can we move with it is important, because as I referred to earlier, young people are change makers, so they have some of the best ideas, and to run with them, to kind of flesh them out a little bit more, and to provide them with the support means to kind of create something out of just a thought that came into their head is really important. But I think equally, if you haven't got that kind of space to say, well, how can we do something, even engaging within, so if something's a priority for children and young people, so for example, going back to core 20+5, we knew that health inequalities affect children and young people, so we use kind of like proof of concept, and we did the health inequalities project with the NHS England Youth Forum that showed that yes, health inequalities do affect CYP. And from there, we worked with the team to create the infographic, to create the framework itself. So I think both are really important. The ideal would be going in with what's your priority. But then I think, as I referred to earlier, it's important to recognise that not every young person has that confidence to speak up about an idea or a thought that's come into their mind. And I think in the interest of kind of leveling the playing field, sometimes engaging throughout a process is important, because it might just enable the young person the next time to say, actually, I've got an idea now.
Yeah.
So yeah.
Brilliant. So what other, because I love all of this and I want to go through all of us, but I've got mindful that we've got 20 minutes left.
Yes.
Oh, can we keep sharing it for a second? Just, sorry, I was trying to get into the questions as well. So we can share this with people. I think there was a couple more points you wanted to bring up, wasn't there?
Yes, there were. So for me, the other so all important, but the other kind of key point for me was around creativity. So when you are engaging with a child or young person, think outside the box, use different methods, use different means, because young people don't like plain and boring. So think outside the box. And to do that, I think it's often quite helpful to like be open and ask just questions on how like a young person wants to be engaged, like whether that's like a big poster, or whether that's like a doodle board or a jam board or something. Like ask them, because you'll only know by asking. So really important to be creative in that sense. And then we've touched on it earlier, but I think I would say recognizing a young person or child's contribution towards something is really important. There are definitely other means of doing it apart from kind of like monetary means, but I think it's important like regardless of the situation, to show a young person or child that their contribution has been heard and used. So for example, with the Core 20+5 for CYP infographic, we made our suggestions. We had like an initial infographic, made our suggestions, and when we saw the final model, like we were all picking out what bits we suggested because we could see it come to life. That's how we knew that our voice, our suggestions were heard and actually integrated into what we were doing.
So there's a question in the Q&A, and it talks about how to set up a group that's inclusive. And I think it was probably there before we shared this, but I think for me on here, the bits you've said are really important. The bit one on here for me is the 10, the support us, give us the power, get out, reach out like you're doing, don't make it boring, like you've just said.
Yeah.
We need to think about our focus groups quick. But if you are the only young person, and if you're one of many young people, to make sure there's a safe person for you to speak to, somebody who's going to make sure that works with you to give and checks in on you afterwards as well. Absolutely. I think it's really important.
Yeah, absolutely. So support, I think, should be the first thing that's kind of thought about before everything, because having a good support system in place makes it a lot more, it makes it a comfortable environment for the young person or child, and it makes it more likely for the young person to engage in something as like policy delivery or co-designing something again, because I come back to the same point, but not every young person has the same kind of like confidence or skill set. So having one person who can almost act as a mentor, as a support system, as a point of contact for that young person or child is really pertinent, because they can go back to them and ask anything. I mean, I've had mentors as part of some roles before, and the kind of questions that I would ask, like now thinking about it, even I'm thinking that at the time they were important to me, and I don't think I could have raised them in the kind of room that I was in, but I had somebody who I could go back to and ask them to, and that was really key.
Brilliant. And I'm coming to another question now, but it's made me think of another question too, and it's one that we've worked with. Getting the voices of children with young people with learning disabilities into a room to help them form. Like, have you any advice on how you've seen that work well? I know in our lived experience, that was one of the challenges we had, was to make sure that we had that voice in the room. And then hearing the experiences that learning disabilities, children with learning disabilities have, and adults have in how they feel valued by the health service. So I think it's really important, if we're going to hear voices of children, young people, how would you advise that you can get those voices in?
Yeah, absolutely. So I think the one thing that I definitely will mention is that every child and young person has a right to be heard and listened to, and to be taken seriously according to Article 12 of the UNCRC Convention. And so kind of given that in mind, it's so important that you go out to children, young people, for example, with learning disabilities or long-term health conditions, and I think the approach to doing so, I'd say, would be slightly different. So it kind of comes back to my point about leveling the playing field. So what I possibly would do is I'd go out to I'd go out to like communities of young people, for example, with learning disabilities, but I'd provide them with, for example, like a taster session of a youth forum before like almost dropping them into the deep end of joining the youth forum itself. So I'd give them the opportunity to give it a go. I'd like mentor, provide that skill set even before they join. So I'd provide them with the opportunities beforehand so that they can have experience it, have a taste of it before doing so. Because, and I come back to the same point again and again, but I think having a good experience of engagement is key, because if you don't, it will at the end of the day potentially leave a sour taste in a young person's mouth, and they're less likely to give their opinion on something again in the future, and that thing might be incredibly valuable or really important to them.
Brilliant. And so important. But I suppose And somebody is asking a question about, making sure ICS is consistently including children in the feedback loop and working with them in children, young people, and working with them in partnership. And I get the human rights about it, but I'm not sure if Yvonne Newbold is on this call. She had registered to go to it. But, through a lot of the work that she's done, and you've met her on the NHS Assembly with me, and stuff I've heard through a lot of our lived experience, is that the experience isn't good. The experience being listened to actually isn't happening. And I'd love to see that the Core 20+5 as well could look at that to make sure that we are genuinely hearing the voice of all patients, be them, and I know we're focusing on children, young people here, but the voice of all patients, despite their conditions, or
Absolutely.
that we give that power over.
Yeah, absolutely, exactly. Because everyone has a voice, and I think for young people sometimes it can feel like, well, it's just another thing, it's just another problem, it's another suggestion, but it's really not, because you don't know what can come out of a comment or a suggestion, what kind of like sparks can fly, essentially. So it's really, really important that everyone, irrespective of any kind of condition that they have, or any kind of circumstance they're in, has a feeling of being empowered enough to have their voice heard.
Brilliant. Aishah, I'm going to and absolutely, somebody in the chat has said people with learning disabilities may not have the voice as a result of their disabilities, but we've been talking very much about the role of carers and advocates, and making sure that they, that's an absolute valid point. That however the communication is done, and the interaction is done well, and people are listened to.
Absolutely.
So I'm going to ask you an awkward question now, because you were involved in healthcare at the age, because of your experience of at 16, 17. And we've a few minutes left in this, and we're looking at healthcare in the future. We can close down the slide so I can see Aishah properly. That's much better. I hate when you're only just in the corner so much. I feel like I'm nearly sitting opposite you at the kitchen table having this chat. We're talking about healthcare in the future through the lens of young people. And so I know every young person experiences a level they go to their GP. But if we believe passionately, and I think you agree with me on this, the patient partnership and partnership between people, communities, and we look at ICSs, how do we get young people involved when actually they don't even think that they're too busy, they're having fun, they go to their GP when they have to, but actually the future of the NHS is very much in their hands?
So I think really good question, because not everyone kind of has the same experiences, and therefore doesn't have the same kind of like reasons for getting involved. I think for me the key is, it's probably twofold. So the first being that not every young person has to get involved. So if they are quite kind of happy doing what they want to do, that's absolutely fine. But I think at the same time, if more young people and children if more children and young people knew the kind of impact that their voice, that their suggestions, that their experiences from that young an age could have, believe me, they'd be joining up to more youth forums and more campaigns and more organisations that would really hear their voice and shape it, and use their voice to shape and influence things that they could see happen in real time. And I think, like, personally for me, integrated care systems are going to be so key to that, because the actual kind of amalgamation, the join up of local authorities, kind of education systems, health, social care, all together, gives a really holistic view of health, and it should be. So for example, if I look at asthma outcomes, so a young person's asthma outcomes can only can only really be the best it can be by treatment. Other things such as like air pollution levels or the amount of green space they're around account for so much of their asthma outcome. And it's taking that holistic view and that integrated care approach to recognise that actually we need to look at things as one, in unison, like in unity. But yeah, coming back to energizing and engaging young people, schools have a massive role in that, I think, because as I said, teachers are mentors for the best part, because young people encounter them the most when they're that young. And I guess there's an element of kind of like looking up to your teachers and academics as mentors. And if more kind of schools were aware of the influence that young people have through kind of, suggesting, through giving their own opinions, they could definitely encourage more young people to do so. Because I think I personally didn't have that at school. When I was at school, I didn't know about youth forums. I didn't know about youth involvement groups. I didn't actually know that my experience would be taken this seriously. I had no idea. And if I did, I think I probably would have started a lot earlier, sooner really.
Well, you've just raised the challenge for everyone on this call and for the patients' associations. And Maya, my head of comms, and Sarah, my head of patient partnership, are thinking, how do we do this? How do we energize? How do we engage people and go, this is your health and care system, and we need you to be working with us, because that's our role, to make sure that we that we work in partnership to make sure that things move on. We are coming to the end of the time, and Aishah, I'm not sure if you were worried at the beginning that we mightn't get the hour. I think you were earlier, and I think you were thinking, okay, how are we going to talk for a whole hour? And we have done. You've talked about the NICE guidelines, so I think we've covered that as well. Where can people find a link, those people who may not know about the NICE guidelines for children, babies, young children, young people?
It's on the NICE website, but I'll pop in a link.
Fantastic, and we can send out the link after this. So we've got a few minutes left, and I did tell you I was going to do this to you. So what are what is your key takeaway for people in the audience? You've seen there's a variety of healthcare professionals there, and somebody has just said that you have been a great speaker, and they are applying to study a PhD currently in relationship issues, particularly the consent. So I'm sure you get fabulous feedback. What are your key takeaways? What are people going? What do you want people to go away and do after this to get that voice going in their organisation?
Oh, lots of things, but
okay, you've only got three.
I've only got three. So I think my first would be go out, understand where young people are. So I would love for every area to go away and do like a scoping exercise and see where your local youth organisations are for your area, tap into them, understand who they are, like their function, their purpose, understand what the priorities are of the children and young people within those organisations, and then start to integrate their priorities into the work that you're doing, because I'm sure there's plenty of areas that they can have their voice heard. And I would start there. And I think my second would be to understand and to better utilise the role of schools. So to go into schools as you would to a youth organisation, and understand the children and young people there, and to really understand their priorities once again for healthcare, and see what you can do. Because I think schools have, and I've said this time and time again, but schools have so much power, not just from a kind of advocacy point of view, but also from introducing the young person to careers, for example. We think about attracting young people to a workforce, and I think schools are definitely part of the solution, which brings me on to my third point, which is, irrespective of a problem or no problem, make young people a part of the solution, because some young people might not want to be the solution itself, because they haven't got the different kind of skill set, or they just don't feel confident enough. But what you should be doing is empowering them to be part of the solution. So they might not be change makers today, but they can revolutionize tomorrow. And it's all about empowering and making sure that you can support them in doing so.
And I hadn't told you that I was going to give you three, and yet eloquently you came up with three fabulous ones. I think it's coming up in the chat. You have completely inspired me to how we might do this. I'll be picking your brains after this. You have. I'm leaving this webinar with a spring in my step, because I think to have people like you involved in the health service and your passion for getting others. But I'm going to just use a couple of words that people have put in the box about you. Fabulous, eloquent, inspirational, energizing, enthusing, positivity in the face of a lot of bad news right now. And I think what you've done right now for us is you've proved that the future of the NHS is through the lens of young people. So I want to thank you so much for coming and giving us that time. And thank you so much for everyone in the audience. We're just coming to up to 6 o'clock. So I know it's people have joined after work. There are a couple more questions in there about Core 20+5, but they're questions I think you need to bring back to Bola about maybe why other conditions can be involved. We'll pass them on to you and make sure that you can feed them back into that. What a powerful voice. Oh. Aishah, thank you so much.
No, thank you so much for having me, and thank you everyone for listening today. You being here today really shows that you are passionate about children and young people and their involvement in health and social care. So a huge thank you for everyone doing what they're doing. There are so many good examples out there, too many to even name right now, but thank you. I'm really grateful for everyone, and thank you so much to Rachel and the team for the opportunity.